Hello, Robert Brown. How are you doing today?
Good morning, Terry. I'm doing great.
Well, great. Hey, look, this is another interview with a telecom expert, and today we have Robert Brown with YipTel. And Robert, we've had a prior conversation about HIPAA compliant solutions, and you have this great one with YipTel's telehealth solution. And what I'd like to do is talk a little bit more about how that HIPAA product um, solve some needs that maybe certain practitioners in the medical field don't even know that they actually have available to them. Um, so first of all, let's talk about the medical field and the types of businesses in that medical field and the size that may be using a VoIP product already, but don't know that they have the availability of being HIPAA compliant.
Yeah, absolutely. That's a very common application for our product is in kind of that small either individual practice or that smaller maybe regional or something like that care center. Maybe they have 4 or 5 locations, something like that. One thing that's interesting is that with traditional, well, let me start back a little bit because there's actually 3 parts of services that we provide in our telehealth suite. One is the physical phone system. The other is a video telehealth product for connecting with patients, clients, and doctors and training and all of those types of things. And then the third is our HIPAA compliant fax capabilities. The one that I probably see the most confusion about out there is on the physical phone system side. There's a lot of VoIP providers that are out there, and when you go across a VoIP provider, I'm seeing that many of these smaller applications or smaller clinics or individual doctor's offices are not realizing is that most of those VoIP providers are not running in a HIPAA compliant environment, won't sign a BAA agreement with them to assure that they are, and actually are sending their phone calls across the internet in an unencrypted format. So the exposure to that is actually fairly significant. And that's one of the things that we want to help them to understand is that when going to VoIP, you can certainly choose VoIP, and VoIP is an amazing solution for a medical practice. But you got to make sure that that VoIP provider is doing so and delivering and has designed their network in order to support a HIPAA compliant environment, and then obviously can agree with you through the BAA agreements and provide those type of assurances to you that you're actually in that HIPAA compliant environment. So that's one of the biggest things that we want to help organizations that are out there that are looking to find these very flexible, powerful VoIP solutions, is to make sure that they really understand that you can't just go out and choose whichever one you want. You really have to do your homework because, at YipTel, we're actually one of the few HIPAA compliant voice over IP providers in the industry. And what's also unique is we don't provide that just within one product because our products kind of dovetail into each other, where you may be using our phones on the desk, but that same phone now can be part of our telehealth video solution that now is connecting to a patient or a client either on another video phone at their location or on their iPad or some other type of device. And so what we've done is designed our network to make sure that across the board, all the way across on all these different parts and pieces that we tie in, everything is 100% secure and encrypted and in that HIPAA compliant environment. So that's the beauty of kind of tying those pieces together, but doing it from a provider that has built their whole system based on a HIPAA compliant environment.
Okay, great answer. We need some clarification. Okay. Um, First off, let's talk about the initials that you're using, the BAA agreement. What is that exactly?
So the BAA agreement, most HIPAA compliant or most medical practices will be pretty familiar with these. These are those business associate agreements where essentially I sign a document with the medical facility that certifies or verifies that in writing I am saying, yes, I am HIPAA compliant and abiding by these HIPAA rules. And so if you're working with a provider that's not willing to sign that, that's because they're not HIPAA compliant and they don't want that liability, because essentially by doing that and signing that agreement, I'm saying, yes, we are, and yes, we have done all those things and continue to do all those things and all the different parts and pieces that come along with that. So that's a very, very critical piece, is because as a medical practice, they're required to have those assurances from their vendors, and that's one of the beauties, is that YIPTEL will sign that BAA agreement directly with that provider.
So what I hear you say, Robert, is that if I am a medical practice and I'm looking for a phone system, the first question out of my mouth shouldn't be what's the price. It should be, do you have a business associate agreement?
That's exactly right. That is a great first place to start with. Number one, do you have and will you sign the BAA agreement? Because that pretty much should be a non-starter. Is if they can't and don't, then that's you can't put your practice at risk like that. So
Right, and so let's go to one of the other things that you talked about, and that's sending when you have a phone system and it's VoIP, whether it's cloud-based or it's premise-based, that means that all the information that they're communicating through their phone system is unencrypted and it's open and it's in violation of HIPAA.
yeah,
If they're discussing anything patient related.
yeah. So if they're having those patient-related conversations, which obviously those medical practices are, then they need to make sure that they're secured. So it's a little different. You know, YIPTEL provides both on-premise solutions and solutions from the cloud. And in an on-premise solution, it's different because we can design a private network with private connections all coming in that then are safe and secure, and we can deliver it in that method as a HIPAA compliant environment, because it's all safe and secure because we've provided direct physical connections in between the locations. So some of our larger scale practices, they may have their network designed in this fashion. What sometimes they don't realize is that now if I have a smaller office or people that are working from home and I've now connected them, unless I've done that in a encrypted format to these remote or teleworker type applications, those may be some pieces that they didn't think of that now are exposed that they didn't really even realize. And so that's really, you know, it's really about understanding the applications, what the practice is trying to accomplish, and then delivering the right solutions. Because we can deliver it in a premise-based solution or from the cloud, but when we do that, we're very good at assuring that every little part and piece of that we put together is going to be HIPAA compliant, because obviously we all know the fines are huge and we just don't want to have any of those type of risks associated with that. And so that's why it's very critical to make sure you work with a provider that understands all of those little parts and pieces and how to tie them together.
Okay, great segue into this next section. You mentioned the fines are huge. The law changed, and everybody's subject to these new laws, whether they're actually aware of the intricate nature of those new laws. Correct?
Correct. Yeah.
All right. So we have these practices out there. They're doing business like they normally used to do, but now the law changes, and so they have to re-examine. And I'm just imagining this because I'm not in the medical field, but they have to re-examine how they communicate with if I'm a doctor's office, they have to communicate with the pharmacy, with the hospital, coordination of benefits, all of these different things that are directly related to the confidential information of a patient. And if there's any leakage in that, then they're susceptible to being fined and penalized. Is that correct?
That is correct. Yes, and that's where a lot of people like I found some people the other day using Skype, and they're like, oh, well, Skype is secure and all of that, and so I went to Google and I typed in, is Skype HIPAA compliant, and obviously here comes up all the things that Skype is not HIPAA compliant, and so it's just I think it's not that these people are trying to obviously do something wrong. They just don't realize that some of the applications that they may have thought were okay, just using a VoIP provider or using a product like Skype or, those types of things.
Or Google Hangout.
Yeah, they thought that they were okay, but they just didn't realize and know that, what, those actually aren't. And Skype's certainly not going to sign a BAA agreement with you that you're okay as a practice to use their service. So it's really about we really help in the education process, and we just help and work with those different individual groups to make sure that we've designed the right solutions that are going to protect them and their patients.
Okay, I think that I like the answer, but I need a little more from you, Robert. I need a little more. You guys are in the consultative sales business. I mean, you don't have a solution that you're trying to pigeonhole every one of your clients into. So, do you have a staff that is aware of these medical issues and consequences that you feel comfortable having that conversation to understand exactly what each physician's office, medical, facility, the intricate nature of those conversations, so that you can assist them?
What's interesting is we have a 40-plus year history of delivering telecom solutions to organizations. We have an amazing engineering team and very well-trained sales consultants. I guess you call them salesmen. They really look at themselves more as just in that consultative approach. And so the experience isn't one of, hey, let's see what we can sell you today. It's really about understanding. We're going to ask you questions that you probably haven't been asked before, because it's about understanding your practice, how it operates. But not only that, by working with all these different practices, we've seen and created those best practices and those applications where oftentimes we can help them dramatically improve that practice because of the ways that we can show them how we can do these things. So it's not just about necessarily meeting needs, it's also about demonstrating and showing things that maybe they were unaware of. Especially like everybody's heard about this telehealth video and all these great things that it can do. But there's very few practices, especially, it's really only the larger ones that are using it. So those smaller clinics and individual offices, they're not using this product, number one, because in the past it's been so expensive, but they didn't know how to deploy it and really how to use it and how to interact with their patients in that fashion to strengthen those relationships. So what we do is we come in and we demonstrate those technologies and we help them to see and essentially learn the things that maybe they didn't know and understand, so that we can help them to grow their practice in that fashion. So it's a great experience. I love that process of helping them to learn and understand the things that these new technologies can do. And it's interesting because occasionally we'll hit a doctor's office where they're a little more what I would call old school, and they're like, oh, I'm not sure if we want that type of technology, and we want to communicate with our patients that way. And we can certainly understand that, and it's not right for every practice. But it's interesting to me to see, once we put it in their hands and give them a free trial of the product and show them how it works and how it can work for their practice, that virtually everybody said, oh, now I understand it. And I start getting the different type of questions. Well, can it do this? And can it do that? And how would we do this? And, I started to see the light go on in their eyes, and they're all excited about the types of things it can do, because they can see that this is, the telehealth solutions that we deliver are game changers. It's the ability to connect with their patients on any device, anywhere, in a secure HIPAA compliant environment. And once they kind of get the grasp of what that could do for them, it's that even that mental health provider, now they can provide services to their patients anywhere. Their patients will go on vacation and they need to communicate back with them from wherever they may be. Now we can do that in a secure HIPAA compliant environment. So we start to kind of just open their eyes, and I love it when I see that light go off and they get all excited about the solution, because that's really what we're about, is helping them to find new and innovative ways to strengthen their practice.
Okay, now that sounds expensive. You're doing all this consultation, this an analysis of their business, and these new opportunities for them to communicate with their patients. It sounds expensive, Robert. If they're already on a VoIP system, what are they going to have to spend a lot more to switch over to a HIPAA compliant system?
It should be really expensive, Gary. It should be really expensive. But one of the beauties is that, of course, it's not. Our HIPAA compliant solution is about the same cost as all of the other providers that are out there on the phone system side. So if you're running with a VoIP provider, our costs are just about the same as, if not less than, many of them. So yeah, it's extremely competitive. In many cases, depending on the phones, but in many cases we support a lot of the phones that are out there in the industry. Like the Polycom phones are a very common phone. And those phones, when we connect them to our system and they download our software that goes on to them, those now are fully encrypted on those phone conversations in between them and their patients. So that's one of the differences, is it's not, they may even have the right technology in their hands that's capable of doing it, but they're just not currently using that. So they could reuse those same exact phones. They can use soft phones. They can use their devices that they already are using, with their nurses, with their iPads, or those types of things. All of those things are the devices we use. They're not proprietary to us. And so a lot of the practices already have half of the technology, if not more, that they need, and then we just turn it on and plug it into us, where it's fully compliant and HIPAA and secure and encrypted, and off we go. So that is one of the beauties, is that the costs themselves, that's one of the reasons why people will want to do this, is because it's going to lower and typically reduce their costs because of the savings that we deliver, coming in voice over IP. Now we can deliver, the video, the telehealth piece, extremely cost effective. There's no equipment they have to buy. They can use the same laptop that they're already using, or iPads they're already using, and communicate with their patients over those devices. So there's literally nothing they have to purchase in order to today start providing that service to their patients. And then tie in the fax piece, and the fax is about half the cost of a traditional fax line. So, there's savings on all of these parts that we tie together. There's cost savings. And so when it comes to cost, it's interesting. It's one of those things, you've always been told you get what you pay for. And I totally believe that that's true, except for this. Because this is the one thing I found where it's gives you so much, but yet the cost is so little, but yet it's true. So it's one of those catch-22s, I guess.
Well, very good. I think that's a great explanation. I mean, look, if you are already into a VoIP solution, but you're not HIPAA compliant, you have a couple of choices. You're going to have to bear the risk of being caught and being fined and penalized. Um, I guess there's another option, and that's trying to um, get all of your things HIPAA compliant yourself, which sounds like that would be administratively time exhaustive and expensive. Or you could find a solution provider that can get you that HIPAA compliancy in your telecommunications, and YipTel would be the choice, correct?
Well, I certainly think so. We've really specialized our organization, our teams, our sales, our support, our engineering, everything around the medical field to be able to assist them in helping them to maintain that compliance, providing the agreements that assure that, and then delivering amazing, reliable, and fast products and services that will help them to grow their business. One thing that's pretty interesting about us is, even as a carrier, we have a little bit of that. Maybe we're a little old school ourselves in some respects, because when it comes to customer service, we're definitely old school, and we live answer our phones. As people call in, they get directly to a person, and we don't have this multi-tier where you call in, but then you can't talk to an engineer to actually solve or work on your problem. It's frontline answering with customer service, and then from there, if you need technical assistance that they're not directly trained on how to resolve, then you go straight to an engineer that is. So it's a pretty amazing concept from that aspect as well. And I like people to understand that about our company, is that not only are the products HIPAA compliant and all the things we can do, but the experience that you have with YipTel is just as critical to us. And so we really protect that. We work very hard to just connect, and we actually leverage our technology. So you're out there with a video phone on your desk. When you're talking to us, obviously you're in full video and working right personally and interacting with our, we'd love to interact with our clients just that in that same fashion, because it builds that relationship. And so it's really a pretty unique customer service experience, and I wanted people to know that about our organization as well.
Very good. So, Robert Brown, it's that time. Tell people how they can reach out and communicate with your company.
You bet. They can reach us over the phone on our 800 number at 800-752-6110, or they can reach us at off of our website at YipTel, which is YIPTEL.com. By the way, YipTel, I get that question all the time. Where did that name come from? And it comes from your IP telephone is YipTel, and so that's why we chose that organizational name. So.
Well, very good. Robert Brown, I appreciate your time today, and thanks for giving us some further clarification about this HIPAA compliancy issue and how you can help resolve it.
Perfect. Thanks a lot, Kerry. Have a great day.